Hey everybody, this is Matt Hsu with Kristen here at Upright Health, and we are continuing movement tutorials for medical professionals. Today we are looking at the forward arm raise, so we're just going to have Kristen show you this wonderful example of a forward arm raise. She just brings her hands forward in an arc all the way up above her head. You'll notice that her humerus lines up with her ear, she's got perfectly vertical arms, and she's doing that without any other compensations. A lot of times with clients we see here, and probably for you with patients that you see with shoulder issues, there are two major faults that happen with this movement. First of all is the shoulder shrugging. So Kristen is showing you what happens. The shoulder blades are a little bit protracted and they're a little bit shrugged, and what that means is the clearance for the humerus in the glenoid fossa is reduced, and you'll probably run the humerus or some other piece of soft tissue into the acromion process or something else. So a lot of times people complain about anterior deltoid or medial deltoid pain with doing this. So this can be a strength and or a coordination issue. If it's a coordination issue, then cueing your patient to relax in the top of their shoulders, so relaxing in the upper traps and in the levator, this whole area can help move through that motion better. The other thing that you can do, if you go ahead and face this way, is try to get them to pull the shoulder blades a little bit down and back, and then raise the hands up, and then that might be enough to help cue that so this doesn't get over engaged. The other thing that you might see is a tightness issue. So as Kristen comes up, she's trying to get her hands up, but you'll notice here that her arms actually relative to her rib cage are not as vertical as they're supposed to be. She's actually tilted her whole rib cage and gotten hyperlordotic in order to get her arms vertical. So this, so you can see again right here, this is often an issue with tightness. It could also be a strength and coordination thing, but a lot of times it's an issue with tightness. So when you see either of these situations, it's a good idea to stretch out the lats. So the lats actually attach from the lower back, and then they go up kind of through the armpit and up to the front of the humerus, right? So it's going to attach right up here, comes up like that, comes up from the back and up to the front here. So when it gets tight, it makes it very, very hard to raise your arm up. It's literally the most obvious restrictor of this motion. So to do a lat stretch, what you can do is just use like a tabletop, or we're going to use the bench here, and you can just come down, have your patient come down onto the bench with your hand or onto the examination table that you have, and you're just going to have them pull, so like they're trying to get a stretch through the armpit. So we're going to have Kristen do this here. She's just going to bend forward. She's going to have her hand on the bench, so she's got some traction. She's taking a step back with her right foot, and then she's getting the stretch all the way along the rib cage and then down this way. She wants to feel this stretch up near the armpit and up near that shoulder blade. And by pulling this right hip away from the right armpit, she's able to get more of a stretch. Another variation of this is to do the same thing but with the palm up, and that actually helps get the lat in a little more of a stretch position. So she's just going to have palm up and then just out like that, pulling the hip back, and again looking for a stretch right along the route that the lat attaches on. So you could do this on a table, you could do this on your exam table, do it on a bench, you could do it with a foam roller. There's many ways to do that. The other thing you want to do is scapular retractions. So that's something that we've talked about many times in this movement tutorial series. And that's, again, just practicing moving the shoulder blades back, retracting them without using the shoulder blade elevators, right? So levator scap or upper traps, we need to try to cut those out so we don't get that shrugging, and so that we're able to use the rhomboids and middle traps more. So hopefully that gives you some good ideas in case you have patients that you see who have trouble getting the forward arm raise, and I hope that you remember that pain sucks.
Life should.